Okay, guys, listen, I'm sitting in my office now, and I'm actually reviewing a case that we're going to do all on fours on the top and bottom. We're going to change his whole life, his whole structure of his life. He has teeth here, right? But this is why we need a 3D dimension on his teeth here, because it looks like his teeth are not that bad, correct? It looks like his teeth are okay. We used AI to draw in his mandibular canal and his mental foramen, so we know where those areas are. We have his sinuses way up here, so we have room to work within his sinuses. But this is why we poured up this case. Listen, this is how his case is sitting. I don't know if y'all can see this. Let me take his bite off. But I poured it up just so I could take a look and study his case. He has an overbite. If you can see, let me see if I can make this. This is his bite. His overbite is sitting like that. You see his maxillary teeth, his upper teeth are sitting way in advance. So that's considered a class 2 bite. His teeth are sitting way in advance. So what we're going to do is look at his x-rays, look at his 3D scan, and what I'm going to have to do is move these teeth back, meaning I'm going to extract the remaining dentition. I'm going to take these teeth out, and I'm going to place his implants along the palate to actually close that class 3 bite. I can't wait for y'all to see the results, because see, the side his teeth are coming out this way, and we're going to do it all on X on top and bottom so we can correct his bite. And I can see everything here I need right here. From a 3D scan, mid-sagittal, I can see exactly how much bone I have in between here. And I can see up here, and I can actually move this all the way around to see a 3D image. I'm telling you, AI is the bomb, where I can see every bit of bone he has on the palate and on the mandible. And I can actually work my case before I actually do the case. I can drop the implants with this software. The size, the shape, everything, even the type of implant on this software here. And I'm telling you, it's amazing what we can do with dentistry. We're going to correct his bite. His surgery, I think, is next Friday. But we're going to change his bite by removing these teeth and bringing his bite back with full arch implants. It's going to change his life. You know, a lot of patients don't really care about how I do what I do. All they want is pretty functional teeth. He's going to get that and more, but it's a deep thought process, meaning we have to do these cases and study these cases before we actually go in the surgical suite and do them. We have to know where our landmarks are, the sinuses, the mandibular foramen. We need to know how much bone we have. I don't know if y'all can see this, but I can see how much bone I have available. All up here, I can use that bone. That's good bone up in here. And in the bottom, I always try to look at my bone here, and I can put as many implants as I need to. But right here, I can look mid-sagittally down here in the bottom here, move this down, and see how much bone I have around the premolars and the molar teeth available. I don't know if y'all interested in this, but this fascinates me. It really, really does, because I can see everything I need to do. I can do the surgeries before we start, and then I go in. We actually have a surgical suite. We put everything up. I can put these images up on my backboard. I can see exactly where I'm working, and then we have the implants already set out. We have a whole surgical suite with all the instruments I need, and we just go to work. We numb the patient up. Some patients ask to be put to sleep. We inform them, then we oblige them. We do have anesthesiologists on staff, but a lot of times you're not needed. We have nitrous oxide and Valium. We can actually make you very, very comfortable so we can see your bite as we're doing the surgeries. And not only that, we time our anesthesia. So once we numb you, we use a very stringent Oragel, if you will, to numb the areas first. We give the injection, minimal discomfort. We time our anesthesia so we know exactly what time you're waking up. So if we need to give you more, we do. We give you the pain pills and all of that before the surgery, so you already have it. We give you the Tylenol. We monitor your blood pressure, all of that. Smiled by Dr. Heavenly. We give you the best service possible. I try to do all my jobs well. I'll talk to y'all later. Hopefully y'all enjoyed this, and leave your questions at the bottom, because I can answer any questions you have. We do have financing available. This is an investment, but it's so worth it. And I'm about to change this man's life. Smile by Dr. Heavenly. I'll talk to y'all later.